All right, guys, we're going to talk about splinting both joint immobilization, so elbow, wrist, shoulders, knees, ankles, as well as long bones. For the sake of this, we're considering long bones to be humerus, the radius and ulna, tibia, fibula. Our femur is a long bone, but we do have a separate splint for our femur that we'll talk about here in another video. So for the sake of this one, we're going to say that initially our patient's left elbow has been dislocated. So first things first, I'm going to come up with my PPE on. I will talk to my patient to determine his LOC. If it was a big fall or patient had a loss of consciousness, then I would instruct my partner to take C-spine. If that's not needed, I'm going to go ahead and assess my ABCs. So I'm going to look in the airway. I'll assess his rate, depth, and effort for breathing, as well as I'm going to make sure that his skin is pink, warm, and dry, and he does have radial pulses. I'm going to instruct my partner to go ahead and take manual stabilization of the injured extremity. So they're just going to hold it in place so that it's not free moving around. I'm going to check what we call distal CMS. CMS stands for circulation, motor, and sensory. So I'm going to check the pulse. Distal means further away from the site of the injury. So I'm going to check his radial pulse since we're talking about his elbow. So I'll check his radial pulse, make sure it's intact. I'm going to have him wiggle his fingers to make sure that the motor neurons are intact. And then I'm going to make sure that he can tell me which finger I'm touching without looking, or make sure that he can feel me rubbing his hand. Once that is all intact, I'm going to take my SAM splint, which my SAM splint usually comes rolled up as such. It'll usually come rolled up whenever it is brand new. When we unroll it, it unrolls into this. I'm going to take and I'm going to measure against the uninjured extremity, and I'm going to measure how long I need my splint to be. Since this is a joint, I need to immobilize the bone above, the joint itself, and the bone below. So for this gentleman with an injured elbow, I need to make sure that I'm immobilizing his humerus, the elbow, and the radius ulna. So I'm going to measure out my splint on his uninjured extremity. Get it set up. Okay. SAM splints are great because you can start to mold it to fit around extremities so that it's nice and tight and comfortable on that extremity. I'm going to come around to his injured extremity. I'm going to have my partner lift it, and then I'm going to place the splint, and I'm going to start to wrap my injured extremity while my partner is still stabilizing and holding the splint in place. The wrap does need to be tight, but I don't want it tight enough to where it is cutting off circulation. We also want to avoid putting the wrap right in the crook of the elbow, as that can create a pinch point, can pinch their skin, can create a tourniquet effect and cut off blood flow. So we want to be extra careful about that. I'm going to take the end and I'm going to split the end of it so that I can tie off my wrap to keep it in place. So we're going to tie that off. Next, I'm going to apply my Sling and Sloth using our triangle bandages. They are called triangle bandages because, voila, they are a giant triangle. This one is already pre-tied. If it wasn't, then we would want to tie a knot at the end of the triangle. I'm going to come around I'm going to place part of the bandage underneath the arm. I'm going to pull that knot. What that knot does is it creates a nice little pocket for the elbow to sit in. I'm going to bring my triangle bandage up and around the patient's neck. We're going to tie it off so that it holds it in place. What this is we've just created a sling. It is keeping the arm from this kind of motion. That SAM splint is there to remind them not to move it, but it's flexible enough, as you saw me bending it, to where if they wanted to straighten out their arm, they could. The next thing that I'm going to do is I'm going to create a sloth. That sloth is going to come around the patient's back, around underneath the uninjured extremity, and we're going to tie this off. What the sloth does is it prevents any lateral rotation. So now they can't straighten their arm and they can't laterally rotate it out. Once that is done, I'm going to reassess CMS. So I'm going to check my patient's pulse, have him wiggle his fingers. Which finger am I touching, or can you feel me touching you here? That is splinting of a joint.